Hello, welcome to McLaren Orthopedic Hospital. My name is Michelle and I'm the Surgical Services Educator for McLaren. McLaren Orthopedic Hospital is the largest dedicated orthopedic hospital in Michigan. We are able to offer better results for our patients due to our orthopedic specialty. Our orthopedic surgeons combine their talents with dedicated staff and orthopedic team members to get patients out of the hospital and back on their feet quicker. We're also a Center for National Orthopedic Research and partnered with Michigan State University. Our dedication extends to exploring new methods to treat patients even better. We've also been consistently ranked in the top 10% among our peers nationally. McLaren Orthopedic Hospital is able to offer patients healthier outcomes, shorter hospital stays, experienced, dedicated orthopedic professionals that are focused on you, your treatment, and your recovery. We also provide all of your pre- and post-operative care. Joint replacement surgery is also known as arthroplasty. That is when we are going to remove the damaged joint and replace it with a new one. A joint is where two bones come together, like a hinge or the ball and socket of your hip and knee. Replacing the joint can help you relieve pain and get you moving quicker. Joint replacement surgery has become very common. According to our national statistics, we're doing approximately 500,000 total joint replacements a year. However, every surgery is different. How long your surgery takes depends on your care, your health needs, your degree of arthritis, and your provider. Generally speaking, an average total hip or total knee procedure takes 1 to 2 hours. With a knee or a hip surgery, you'll probably be able to go home in about 1 to 2 days. If you're elderly or have additional handicaps, you may need some additional care at an intermediate care facility, otherwise known as a subacute rehab. After hip and knee surgery, you'll often stand or begin walking even the same day as surgery. You may have some temporary pain or surgical pain in the new joint because your muscles are weak from not being used. And your body is also going to be healing from your new surgery. Pain is expected, but should be improving daily. Physical therapy may start as early as the same day, depending on your operative time. Therapy will strengthen the muscles around the new joint and help you regain the motion within that joint. Therapy will also help you with gentle range of motion exercises. Gradually increasing your daily activity will increase your independence and enhance your recovery. As you prepare for surgery, there are a couple key points we'd like to address. The first is any smoking or tobacco use. We request that you quit or refrain as long as possible. Smoking alone is an irritant to your lungs, and anesthesia is also an irritant to your lungs. Quitting smoking is important anytime you require general anesthesia. Every day that you can refrain from smoking before your procedure reduces the potential for lung problems and complications you could experience following your procedure. The other key point is any illness or infection. Several conditions can lead to complications during your procedure or recovery. So if you have an active infection that requires antibiotic treatment, such as an upper respiratory infection, a sinus infection, or a bladder infection, those are conditions you would need to notify your surgeon about that could potentially delay or postpone your surgery. We don't want you to have an active infection before we start, because we don't want you to end up with a surgical site complication. Additionally, we want to reduce the number of microbes that are on your skin. Normally, as humans, we have microbes on our skin, but as you're coming into surgery, our goal is to reduce those to reduce your risks. So if your surgeon has prescribed for you a special antibiotic soap, we would like you to follow those instructions. If he has not given you any special soaps, then just preparing with an antimicrobial soap such as Dial ahead of time is perfectly acceptable. We do prefer that you shower the morning of surgery, but if you're not able, at least the night before. If you shower the night before, please use clean linens, clean clothes, and pack clean clothes for the next morning. Part of the preparation for your surgery is to obtain medical clearance from your primary care or cardiologist. You've probably already seen your primary care or cardiologist to get cleared for surgery at this point. Additionally, part of that medical clearance includes some of the blood work required for surgery. One of the things required is a type and screen. A type and screen is required to be done at the McLaren Orthopedic Hospital or at our McLaren Greenlawn campus. That blood work does need to be done within the 14 days prior to your surgery. All other blood work also needs to be done within the 2-week time frame and may also include a urinalysis and or an electrocardiogram. Okay, so what to bring with you to the hospital? We want you to bring the things that are going to make you comfortable and successful. But bring just the things you're going to need immediately after your procedures and those which will increase your comfort. A lot of patients will ask, can I wear my own pajamas? And the answer is absolutely you can. But a couple things to consider are the length of stay is 1 to 2 days. We will keep you covered at all times and protect your modesty. And you'll likely have a large bulky dressing after surgery and additionally possibly a drain for a day. So considering those things, it may be difficult to get your own pajamas over that drain. Given that situation, we will keep you covered, and if you choose to bring your own pajamas, please bring something that's loose and bulky so that it does fit over to help cover your dressing. Generally though, once patients are ready to get into their regular clothes, it's been that day or two and it's almost time for you to go home. So most patients will pack just loose, comfortable clothing to wear in on the morning of surgery and plan to wear those on the day they are discharged. As far as valuables go, we are going to ask you to leave your valuables at home. Please don't bring a lot of jewelry or cash with you. Jewelry needs to be removed for surgery. The metal against your skin is potentially a burn in the operating room. That's the rationale why we ask you to remove it. So please leave your jewelry at home. I know they're sentimental, but we really don't want them to be lost, stolen, or damaged. If you wear eyeglasses, contact lenses, hearing aids, dentures, or have any prosthetics, you'll also be asked to remove those prior to surgery, but you'll get those back, if not in recovery room, quickly thereafter. For the ladies, we ask that you not wear makeup, particularly not nail polish or lipstick. The skin color and nail beds are part of our circulatory assessment. If you're bringing a walker with you, please just leave it in the car until you are transferred to your inpatient room. The days preceding, this is the time you're going to want to finalize any arrangements for your hospital stay, including your work, family, and pets. You do not need to move your second floor bedroom down to the first floor if you don't wish to. Basically, if you are able to do stairs today, you will be able to do stairs when you are discharged. Stairs is often one of the physical therapy goals for patients. Some of the things that can make it a little easier for you in your initial days at home, though, are helping to have meals provided or prepared ahead of time. Often patients will prepare individual meals that can be easily heated up in those initial days at home. Also, having an area where you plan to spend more time, like a favorite chair or recliner. Have your emergency contact numbers nearby. And also make sure that you pick up any throw rugs and keep your walkways clear. Since you'll be going home with a walker initially, we don't want you to get tripped up in a throw rug. And then lastly, just make sure that you pack the appropriate clothing and your personal care items. The nurse from the same-day surgery department will be contacting you approximately a week before your surgery. She's going to ask a lot of questions on the telephone. She's going to ask you about your health history, any medical or previous surgical history, home medications, allergies, and any lab work or EKGs that have been performed. She's also going to provide you with information like what time to arrive and what time your operation is scheduled for. She'll also tell you when you should stop eating and drinking. So it's the day of surgery and you've arrived. So now what's next? The first thing we'll ask you to do is to park and enter at the patient entrance. Come to the admitting desk where they'll get you checked in and registered for your day of surgery. After that, a registered nurse from the same-day surgery department will come out to get you. She will take you back to the department, and first thing she will do is have you change into a patient gown. Also in the pre-op department, the nurse is going to do a review of your medical history and a pre-op assessment. The pre-op nurse will also verify your surgical consent and do a site marking with you. She's going to give you a pen that looks similar to this to mark your surgical site. she'll request that you put an S for surgery, near your site. So for example, if you were having a left total knee procedure, you would put an S near your surgical site. Later, the surgeon will come in to see you, ask you if you have any final questions, and review your consent as well. At that time, he will be putting his initials next to your surgical site as well. This is a procedure that we do to confirm with every patient every time for your safety. Additionally, every patient that comes for surgery gets an IV placed and a preoperative antibiotic unless you are allergic. Sequential compression stockings are often prescribed as well. This is an example of a sequential compression stocking. It's applied to your lower leg and just velcros on. The middle piece inflates and deflates with air. That helps to keep your circulation moving while you're having surgery and helps to prevent blood clots. Most surgeons will prescribe these. However, if your surgeon does not to worry, there are other things that he is actively doing to prevent blood clots. If you have hair at your knee or your hip, we'll clip that with electric clippers on the morning of surgery. We do not want the ladies to shave the night before. Even though we've been doing it for years and are very good at it, it can put microscopic nicks in the skin, which is technically a break in your skin integrity, and that could increase your risk of infection. So we ask you to not do your own shaving the day before surgery. So if you have any hair, we will clip it. If there's any hair for any of the men, we'll clip just what we need. So now you're ready for surgery. The next step is to meet your anesthesia provider. The anesthesiologist will come over and introduce himself, and he will discuss with you your options for anesthesia. Basically, he will discuss whether you have general anesthesia where you just go off to sleep, or if you have a spinal anesthesia where you get numbed from the waist down and you go off to sleep. Either way, you will be asleep during your surgical procedure and will be unaware of your surroundings. So now you're all set for surgery, you've met anesthesia. The next step is to go to the operating room. So the surgical nurse will come out and meet you. She'll ask you a variety of questions similar to what you've been asked many times before. She'll ask you to review your consent, confirm your name and surgeon, and your surgical site. Once you have that complete and you are entering the operating room, they will get you off to sleep. After you're asleep, they'll position you as they need to for surgery. They'll do any prepping that's required, cleaning your skin, and then putting surgical sterile drapes on. After that's done, the whole team pauses and does what is called a timeout. I like to share this with you because I want you to know that even while you're asleep, we are still focused on your safety. There is a long list of things that the entire surgical team confirms before they start the operation. Once everybody is in agreement that we have everything correct and appropriate for your needs, then the surgical procedure begins and you just wake up in the recovery room. So now that you're in the recovery room, this is the area where you're first waking up from anesthesia. So you might be groggy, you might have some pain, there's some possibility of postoperative nausea and vomiting. These are conditions that the nurse is going to be carefully monitoring you. So this is also not the time where your family will be rejoined with you. You'll be here about an hour, and when you are awake and stable, pain is managed and under control, you'll be transferred to your inpatient unit. Your family will be able to join you there. Shannon will be speaking to you next about what to expect on the inpatient unit. Thank you for choosing McLaren Orthopedic Hospital.
Welcome to 2 East. 2 East is the orthopedic department that you'll be staying after your surgery. You'll be arriving already in your bed for comfort. Once you get to the room, the nurse and the nursing assistant will greet you. You will be hooked up to the blood pressure machine for 2 hours after surgery as we monitor your vitals, make sure there's no post-op complications. You will also be connected to this machine, which is called the PAS machine. This machine connects to the cuffs on your legs that were placed in the same day department to help make sure you do not get a blood clot. You will also have this fall wrist bracelet on your wrist. Please don't be alarmed, as all our patients for 24 hours after surgery are considered a fall risk due to the anesthesia and the pain medication that is on board. When the nurse comes in, she'll be asking you questions about your health history. One of the main things is about your home medications. If you have time and can get your home medications out and write them down on a piece of paper, it's much easier for you to hand the paper to the nurse than to answer the questions, as you'll be very groggy after surgery. You do not need to bring any of your home medications with you, as our pharmacy will supply you with your medications during your stay. After the nurse is done with her assessment, we'd like to start you out on ice chips and clear liquids. This is to make sure that you don't get sick after surgery from the anesthesia. So we will slowly move you up from clear liquids to a full meal. The first day of surgery is the time to get the rest that you need. However, we do get you up and get you moving. The sooner we get you up and get you moving, the better you will do, and you will not get any pneumonia complications, or you will not be at a risk for blood clots. The first time you need to go to the bathroom, it'll take 2 people. The nurse and the nursing assistant will be in to get you up. This is just to make sure that the anesthesia is starting to wear off and there's no problems moving you. The first time you need to get up and to go to the bathroom, for gentlemen, we stand you at the bedside, and for the ladies, we have a bedside commode for the first time. If you do well transferring, the next time you need to get up, we will walk you to the bathroom, because the sooner we get you up and moving, the better you will do. However, once you feel better, you still need to put your call light on, as one of the employees, one of the staff members, either your nurse or your nurse assistant, will need to be with you to make sure that nothing happens. One of the questions that you will hear a lot during your stay is to please rate your pain on a scale of 1 to 10. 1 being very minimal pain, 10 being a lot of pain. If you can kind of gear where you're at right now, it'll help you answer that question. The pain you're going to have after surgery is a different type of pain. It is more of a surgical type pain. However, the nurse does not know that you're having pain unless you tell her. So please do not ever feel that you're bothering her. Our goal is to make you as comfortable as possible so you can participate in therapy and get up and get moving. And as well as to make sure we have you on the correct pain medications to go home on. So please let her know, as the physicians order a variety of pain medications that we could use for you. Another thing to help with pain management is cold therapy. You'll have either an ice bag or you'll have an ice machine at your bedside. Different physicians order different types of ice therapy, however, they all work the same. The next day following your surgery, the day starts very early. At 6 a.m., lab will start coming in and do your blood work, and also the residents or the physicians start making rounds at that time. They will take down your dressing, look at your incision, see how your day is going. We do bedside reporting up on the orthopedic unit, so in the morning, the night shift nurse and the day shift nurse will come in and start talking about the plan. Our length of stay is usually 1 to 2 days, so you will need to start being prepared that it's possible for you to go home the next day or stay 2 days, depending on your pain level and how you're doing in physical therapy. Breakfast is delivered at 8 o'clock. The nurses start making their rounds and passing medications at that time, as well as physical therapy coming on the unit and start working with you. You would have had already been getting up and moving, so therapy just wants to make sure that you're able to do stairs if you have stairs at home, and make sure you're safe to go home. If you had a hip surgery done, you will also have to wait and see occupational therapy. Occupational therapy is a little different from regular physical therapy, as they help with everyday living, putting on your socks and tying your shoes with the restrictions that you have for your hip. You will also be seen by our case management. Case management is who you're going to want to let know if you have those special needs at home. She wants to make sure your home care is set up and your outpatient physical therapy is set up. If you have any questions, she's the one to get you started on that. One of the many questions from the patients is, when do they get to go home? Our average length of stay for our hips and our knees is 1 to 2 days, depending on how you do in physical therapy. We want to make sure that you are safe to get up and move around your home, can do stairs, and that you are comfortable on your pain medication prior to discharge. Discharge occurs when your surgeon, your physical therapist, and you agree that all criteria are met. So your pain is under control and you're safe to go home. Some equipment that you may have to go home with is a walker, your ice machine, and a hip kit if you had hip surgery. Once you have safely passed physical therapy and occupational therapy if you are a hip patient, you're comfortable on those pain medications, the nurse will come in and review her discharge paperwork and answer any questions that you may have. Once your questions are answered, you will be discharged to home. So you will need to make sure you have a ride set up and all your needs met at home. Once you get home, you will need to follow up with your surgeon, so it's important to call and make that follow-up call if you have not already. Another important thing is to continue to do your exercises that therapy has given you, as that will help build your strength and for a better outcome.
Welcome to one of McLaren's Orthopedic Hospital's rehabilitation rooms. My name is Kathy, and I'm one of the physical therapists who may be working with you during your stay here at McLaren Orthopedic Hospital. We're awfully glad that you've chosen McLaren to be your choice for hospitals, and we're glad that we can be part of your first steps in your road to recovery with your new hip or your new knee. Now, when people think of physical therapy, they think of one of two things, or sometimes they think of both. The first one is pain. Oh my goodness, my total joint may really hurt right after surgery. And then the other question is, how am I going to get in and out of my house, or how am I going to get in and out of my apartment or my abode for living? We'll address those two main issues, as well as other facts and other things that we deal with here at McLaren Hospital. The first one deals with pain. One of the things you need to realize is we work very closely with the nursing staff to make sure that we can minimize your pain while you have your therapy time. You also have to realize that you more than likely have had a lot of pain, and that's what's brought you in for your orthopedic surgery. We work well with nursing to make sure that we've timed your pain medications so that you will receive therapy during the optimal time of your pain meds. We'll also use ice. We'll also use positioning changes. Sometimes just getting in and out of bed or doing some simple exercises will help you feel better. In terms of the stairs, here's an example of the stairs that we will be using here at the hospital. We'll get to that in a minute. The first thing I want to talk about are the 5 main components of what we'll do in physical therapy. Now, therapy here in the hospital may be very different from what you've had at home. The 5 things that we work on is first, bed mobility. Getting in and out of bed, the side of bed that you will have at home, or if you don't even sleep in a bed, we'll work with you in getting in and out of your recliner or out of your chair so that you will be as independent as possible when you go home. The second issue that we'll be working with you on is transfers. What I mean by that is getting in and out of bed, or I should say standing up from bed, and also standing up from a chair, sitting down to a chair, and sitting down onto the bed. The third thing we'll work with is walking. Our normal distance that we'd like for you to walk is about 100 feet. However, if you haven't been walking a long distance in a while, we will tailor that distance of walking to what you need to do at home to be functional. Almost all of you will be using walkers. Here's an example here that we use in the hospital. The walkers can be sized appropriately for your height. We normally recommend that you let us size a walker here at the hospital to make sure it's the appropriate height for you, so that you will be able to walk the maximal amount of distance with the most ease. Now, all walkers are adjustable, but we have shorter walkers and taller walkers. So, for example, someone who's 5'2" probably is not going to be able to use the same walker comfortably that somebody who is 6'2" would be using. Some people have used crutches for a while. We also have crutches here that we can use, or if you decide, hey, maybe I'd like to try crutches instead of a walker, we have that equipment available here for you to be able to use. We would like for you to bring in your equipment that you do have at home so that we can make sure that we get the right height for you. If, however, you don't have equipment, not to worry. We have vendors here who would be able to supply, through your insurance company, equipment that you might need. We want to be able to tailor for you equipment that you have or equipment that you need in order to suit you. So we've talked about getting in and out of bed, talked about standing, we've talked about walking. The other aspect I want to talk about is exercises. You will be receiving basic exercises, and these are exercises that have been prescribed by your physician. When you look at the sheet, you might think, oh my goodness, only these exercises? That's not a lot. But these exercises are basic because we need to allow for healing within your hip or your knee before you start more extensive exercises. These exercises, however, are very, very important for you to do in order for you to maximize your strength and maximize your mobility when you leave the hospital and as you continue in your healing. The fifth aspect that we're going to be working on is stairs. You can see we have stairs here at our physical therapy gym. more than likely they're not like what you have at your house. You might have more, you might have less, you might have rails, you might not have rails. You might have a platform. However, be assured that we will be able to get you, maybe with family help, maybe with a slightly different assisted device, but we should be able to get you up and down those stairs. We have never, ever had a patient who goes home who's not been able to get in and out of their stairs, or I should say, up and down their stairs and in and out of their house or their abode safely. So this isn't anything to worry about. The best thing to say is once you're ready for the stairs, we will address those at that time. So now that you've met your criteria for going home, plan on going home. That criteria of getting in and out of bed, standing up with your walker or your crutches, walking the distance that you need to walk to be functional at home, going up and down those stairs that you need to at home, and also having a good understanding of your exercises. So once you meet those 5 criteria, plan on going home. Now, some of you may be discharged from the hospital and your physician will feel that you do not need any additional physical or occupational therapy. So those exercise sheets that we give you, make sure you continue to do them and continue to do your walking. Some of you will have additional physical therapy. That may include physical therapy in your home or it may include going to a facility, the type of facility which would be an outpatient facility. That might be something that you're more familiar with that will have the gym, pieces of exercise equipment, things that you can do at a more advanced level in order to get your knee or your hip stronger. A few of you may go to an inpatient, and what I mean by an inpatient is a place where you will stay for a period of time, where you will actually live there for a period of time. Maybe, I'll give you an example, 7 days or so. This place would be called a subacute rehabilitation unit. Some of you will have already found out that your insurance has this as a benefit for you. However, be aware that in order to go to subacute rehabilitation, first you have to have your surgery, and then you need to have physical therapy and/or occupational therapy here at the hospital. At that point in time, it will be your insurance who will determine if you are eligible or you meet criteria to go to a rehabilitation facility. So, in the end, plan on going home, whether you go to rehab or not go to rehab. And what I mean by that is have things ready at your house. You may need to have somebody to help you with transportation to doctor's appointments or to therapy. You may need to have somebody help you arrange your house so that you have all of your food on the top shelf of a counter or the top shelf of your refrigerator, or that your clothes are within easy access. You might also want to have somebody stay with you for a few days when you go home, just to make sure things run smoothly. So that's the basic part of physical therapy for patients who have total hip and total knee replacements. If you have a total hip replacement, however, there are specific additional things you need to deal with. Ron from Occupational Therapy is now going to talk about the role of occupational therapy here at McLaren Orthopedic Hospital, as well as specific hip precautions. We'll see you soon. We're glad that you've chosen McLaren.
I'm Ron, one of the occupational therapists here at McLaren Orthopedic Hospital. What I'm going to do is kind of go over what we call the activities of daily living. So basically, after you've had your hip replacement, you have to go home and follow some rules, like don't cross your legs, don't twist in, and what we call the 90-degree rule. So basically, you think of like an L. You can't sit down on a low toilet, low chairs, or you can't bend down to put on your socks, pants, things like that. So what I'll do is kind of show you a few basic strategies on what to do once you get home. So some of you may have a tub, some may have a walk-in shower, so I'll discuss various ways to get in and out of there while maintaining those hip precautions. We'll also look to see if you might or might not need any equipment like a shower chair or a grab bar. Another thing I'll look at is if you'll need a raised toilet seat. You know, some people have the elevated toilets, some are short like I am, and they just don't need any equipment, but others will, and we'll discuss that when I see you. Another thing I'm going to look at is getting dressed. So some people will need some equipment. kind of like a sock aid, a little thing to put your socks on with, a little grabber so you can get your pants on, and we'll kind of go over that too. Another thing you'll have to look at is your TED hose. TED hose are compression stockings that you'll have to wear for a couple weeks. Generally, you'll have to take them off at night, put them on in the morning. So they're a little tough to do. Some people, I strongly encourage to get help with them, but some people live alone, and so we'll have to kind of go over some ways to get them off and on by themselves. And the big thing I'm going to look at is getting in and out of a car. So people might have to step up on a running board to get in. Others have just a low sedan. And there's just various strategies we'll work on to get in and out of there. So I'll wait till I see you and we'll discuss all of these things and more. And thank you again for coming to McLaren Orthopedic Hospital.